So this is a 62-year-old female who presents with signs of aging. And overall, what she has is just overall kind of sagginess. In addition to that, she also has some volume loss as well. Because aging is not just about sagginess, but it's also volume loss. So the plan in her was a complete facial and neck rejuvenation, along with fat grafting to the parts of the face that needed more volumization. So whenever we take a look at the face, we look at and divide the face into three parts. The top 1/3, which is the forehead, the middle 1/3, which is the face, and the lowest 1/3, which is the neck component. To kind of break down what we did was, for the rejuvenation of the upper 1/3, we did what's known as an endoscopic brow lift or an endoscopic forehead lift. We use that terminology kind of synonymously. And what we're doing is, through a minimal incision beyond the hairline, we're elevating the entire forehead up. And obviously it's very important not to overdo this, but at the same time, you have to do enough so that it's not just the forehead component that we're addressing, but the upper eyelid sagginess as well. And so when we do an appropriate lifting through the endoscopic brow lift, the entire 1/3 of the face looks very naturally rejuvenated. For the middle and the lower part of the face and the neck region, we have to do what's known as a face and neck lift for her. Because like I said, there is a way in which we can do a minimally invasive facelift, but she also has pretty heaviness of the neck as well, and she wanted a complete rejuvenation. The goal usually for a face and neck lift is, on the lower part of the face as well as the neck, we want to be more aggressive. Because no matter who you are, the cleaner the jawline is and cleaner the neck is, you still look natural, but you look much more rejuvenated. On the top part of the face is where we want to be a little bit more cautious and natural, because it's really in that mid-face top portion of the face where if you pull too much, then you get what's known as a windswept look or an unnaturally kind of pulled look. Then we addressed the bags under the eyes. So we did a lower blepharoplasty, and in addition, we injected some fat into various parts of her face that needed some volumization.